Instant feedback.
Assalamu alaikum wa rahmatullahi wa barakatuhu. Welcome back, and today with our very special guest, Malik Gul and Dr. Agnelo Fernandes. Very, very fortunate to have a lead GP who is from the Croydon Borough, and he has his surgery in Fountainhead. And Malik Gul, I've known him probably for 2 decades. As we go back a long way back, and as I was the former Imam there at the Balham and Tooting Islamic Center, we had a lot of engagements with Malik Gul and Wandsworth Community Empowerment Network. From those many years, I recall Malik never stopped, continued the effort and the work, and today not only we living Wandsworth, we are coming now to Croydon. And that is why the meeting, especially in the wake of this coronavirus and how people have been impacted. Now that we are in the Croydon area in South London, population over 385,000 people. Can you tell us a little bit about the population here, obviously in Wandsworth as well as here in Croydon, and the number of mosques that we have in our local community, and how we can try and network as you have been networking there in Wandsworth?
Do we have a map to put up?
A map, yes, we can put up a map for you, and we hope you can speak about.
So this is the borough of Croydon. 385,000 people live here, but this map is a map that can be drawn similarly for every London borough, and this type of map can similarly be drawn for every urban area in the country, whether you're in Manchester, Leeds, Sheffield, or Birmingham, where I originally come from. The darker areas are the areas with higher rate of deprivation, and the lighter areas are areas with less deprivation. Perhaps
when you say deprivation, what do you mean?
Well, Dr. Agnelo, perhaps you could comment on it.
These are areas where you've got a high concentration of people of Asian, African, ethnic minorities, but also where they have problems with unemployment, with housing, with core problems in terms of parenting, poor schooling, and also not enough shops with healthy food. Lots of fast food shops. And so it's an area where people live because of their condition, because of their relationships with other people from the same background, that creates an area where everybody is disadvantaged. And not only their generation, but generations after them as well. So the dark areas on the map represent the 20% of the most deprived areas in the country. Okay,
does it include Croydon?
It does, and this is just Croydon.
Oh, this is just Croydon. It's not the whole of UK.
No. But
can you imagine how shocking? I mean, this is Croydon. And here we are looking at this map only. And
yes. What's important about this map in Croydon, you'll notice there's a real big difference between the north of the borough and the south of the borough. And the north of the borough is where the concentration of deprivation exists. So more likely to be...
Can you tell me, where our mosques are situated? We have the Croydon Mosque, we have the Purley Mosque, Norbury. Is it in the dark blue or is it light blue?
As you could see, here's exactly the same map. And you could see that most of the masjids that we have in Croydon are situated in the north of the borough, which is where the dark parts are. And can I say, just like what Dr. Agnelo says, you go anywhere in the country, our masjids are likely to be in the poorest areas, because exactly like what Doctor says, we are more likely to live in those areas.
I mean, even Purley is the poorest area?
Well, Purley might be the exception that tests the rule. It might be an exception that tests the rule.
Okay, because a lot of people are moving into Purley area.
Yeah, and Colston.
And Colston, okay.
But the point is important. I mean, I come from Birmingham, and I know a lot of your viewers are from Birmingham. Areas like Alum Rock, areas like Saltley, Baldsley Green, Spark Brook, these areas...
You're making me think that there are a lot of gangsters there, the way you're speaking Alum Rock and all.
But these areas in a Birmingham map will be the poorest areas of the city. And it's in the poorest areas where our masjids are often based, because exactly like what Dr. Agnelo says, these are areas where we tend to congregate because we already live there and then our families come and live there. But if you look at these areas where we are, Thornton Heath, look at the amount of 99 pence chicken shops. Look at the amount of fast food shops. Also look at the amount of gambling shops. These are all concentrated in the poorest areas. So there's no surprise that in the poorest areas there's also the poorest diets.
Okay, so if we take okay, we are in the Croydon. What about people who are, for example, in East London? Now there is a bigger mosque there.
Yeah.
Is it the same?
You will have, if you drew a picture of East London and all the boroughs around there, you'll have a similar sort of map.
Is it?
Yeah.
So it means...
So
yeah.
what that tells us, that if you live in those areas, you're more likely to experience poor health for the reasons that Dr. Agnelo says.
But if people have no choice, they have purchased homes, their accommodation is in those areas.
But what the choice you do have
Okay.
is you have the choice to make good decisions about your health care, about what you eat, about exercise, about sleep, about relationships. You do have the power to make those choices. And what we believe very strongly, it's people like yourself, Imam. And if you look at the map again,
Yes.
look at all the masjids that we have in the north of the borough in the poorest areas.
Okay, can you name me some of the mosques?
Well, you know them better than I do.
Yes,
There's
so we-
Croydon Masjid, of course.
Okay.
Norbury Islamic Centre, which we know very well. Bismillah Centre. I mean, they're all on the map there. Actually,
So we have South London Islamic Centre, Norbury, and Norbury Muslim Centre. Yes, and also we got on the street, High Street alone, after Croydon, we also have an Afghani cultural community centre there. So Thornton Heath, so very many mosques, as you pointed out.
And can I say,
Yeah.
Sheikh, that this is also the same in, and I know you have a national viewership here, this is exactly the same right across the country.
Okay.
The masjids are based in these areas. They're based in the poorest areas. So therefore, our view very much is that we need to empower the masjid.
Okay.
The masjid should be not just the place of prayer. Of course, prayer is its most important function.
All right.
It should also be a place for healthcare and early intervention.
So what you are saying is, Al-aqlu salim fil jism salim, as the saying goes, to have a sound mind, you also have to have a sound body. So, Dr. Agnelo, are you ready to visit us at our mosque and give some advice to our congregation? And also, how can we get our community and the mosque involved and support as we learned from this effort, early interventions? What would you recommend?
So we need to turn things around, completely around. So we need to take healthcare and advice to the population, to the community, and through the mosques, to make sure that, you know, we don't expect people to come to the NHS. We don't expect people to go to GPs. We need to go to where the people are. And that was the big learning from the COVID and the vaccination program. We went to temples, we went to mosques, we went to churches. That's where the people were. And also where people were homeless. We went to areas where people congregated because they were homeless, trying to keep warm.
Right.
So the lessons from COVID is actually we need to do something radically different. We need to take healthcare to the people, to the community. We need to empower the communities to be able to address the issues that we've not been able to do as an NHS.
Can I,
Yes, Malik.
can I just add to that? Because I think
Yes.
this is really important. Because you said, can Dr. Agnelo or any other doctor, GP, come to the mosque to do talks?
Yeah.
It's not about doing talks.
Okay.
It's not about after Jummah prayer, we get somebody down to do a talk. It's not about that. It's about skilling the community itself for the community to start to do early intervention and care themselves. The community can be a centre of healthcare. GP should only
So what
come
you
in
are saying
afterwards.
is prevention better than cure.
Absolutely, prevention is better than cure. If the mosque
But
and
now,
the
you know,
community owns its
the
own
challenge we
healthcare,
have is from the Muslim perspective, we have sickness. When a sickness come upon a person, he's taken all the precautions, and you know, we believe in something called qadar and destiny and fate. Even after taking precaution, now somebody has fallen and became ill. What do we do in this case? Now we have to provide comfort. Imam now's role is to how to make a person understand that even if a thorn has to prick a believer, it is expiation of sins. Now this is what we will normally do, try and, you know, somebody suffered a bereavement, somebody is ill, somebody in hospital. So we have, as the Prophet himself, peace be upon him, when he became ill, a special prayer was read upon him. The angel Gabriel, Jibreel alayhi salam, came to him and read a special prayer. So when it comes to this issue on the faith communities and health and sickness, we are trying to look at how can we, yes, have early intervention, but at the same time, there are cases where the health professionals can also benefit, when it comes to supporting their patients, because from the faith side is sickness, even after all the precautions you have taken, if the Lord Almighty has decreed that so and so will become ill, do you know that when we visit a sick patient, 70,000 angels pray for him. So what do you think about that, Dr. Agnelo? If an Imam is telling his congregation that, health is from the Lord Almighty, we be grateful, but sickness also comes as a test. What do you think of that?
I think there is something in it, but there is also something that I'm sure that we're expected to contribute to that as well.
Okay.
And that contribution is the choice that we make.
Right.
And that choice is something that is powerful, and we can't test fate, but we have a role to play in terms of the direction that we go.
All right. Beautiful point, yes.
You raise an important point, because sometimes with mental health, for example, prayer does help.
Okay.
Yeah. Sometimes if you are a believer, that regular prayer can help with your mental health.
Yes.
But if there is a clinical issue, if there's a medical issue, then prayer by itself is not going to help you. So the point that you raise, Sheikh, is about co-production.
Yes.
How can the mosque and the Imam and the Muslim community and the healthcare professional work together?
Work together.
Work
Why
together.
I mentioned that, because there were patients that had impact of, we call it, they call that the black magic or the impact of the jinn. So now, from the health professional, this person needed medication. Now from the faith perspective, this person, he needed some incantation, a special type of prayer.
He probably needs both.
And
they probably need
probably
prayer
needs
and
both.
medicine.
There was a woman in the time of the Prophet, peace be upon him, she suffered from epilepsy. And she actually, to the nearest meaning that the Prophet said, if you have patient, because she only prayed that she doesn't become uncovered. So it is a fact that there are people that have certain type of illnesses, it's beyond their control. And he prayed for her, because if she remained patient, because she's got that epilepsy, she will get paradise. So therefore, when we look at this from the religious point of view, there are people who are suffering, they are ill, they are sick, and it's beyond their control. There is no cure for it, and how do we give that support? On the one hand, the faith also, faith in itself is a type of healing. And yes, indeed, we need to co-produce.
But can I say something on that, Sheikh, which is really important? We
Yes.
don't want to see our GP colleagues and our NHS and our Muslim communities as separate.
Yes, yes,
We want to see them as part of the same community.
yes.
So when you talk about the medical interventions and the clinical interventions and the prayer interventions and the faith interventions, we want to see these as working closely together. Not
Okay.
you go to the mosque and then you go to the GP. No,
Okay.
you can access healthcare in the mosque. Ideally, when somebody goes to see a GP, the GP might say, well, actually, this person has actually got no medical condition. Maybe they should go and see the Imam. So actually, they're working together.
Yes,
and what
yes.
we want to do is make sure that our masjids and our health services and our GPs
Are working together.
so they're not
Yes.
separate. You go to the mosque for prayer, you go to the GP for healthcare. These old ways of working, separation, us and them, we want to break that down.
Okay.
We want to create new kinds of relationships between the NSS, between the GP and between the masjid, with the masjid in the community being the center of healthcare, not the GP being the center of healthcare, or the hospital being the center of healthcare, but the masjid being the center of healthcare.
So the mosque and the community centers should work together with the health professionals. Can you give some final reflection, your final reflection as we're coming close to the end of our program?
Yeah, so I think you started off the conversation about COVID, and the big lesson of COVID was it exposed the inequalities in the system.
Okay.
And for me, it highlighted that the system we have at the moment hasn't got all the answers.
Okay.
But working together with our faith leaders, with our communities, working with the mosques, working with the Muslim community, we can make a real difference. We can turn this around and actually have better outcomes for all our citizens, both mentally and physically and spiritually.
Thank you so much, Dr. Agnelo Fernandes. Really appreciate your coming here today and benefiting our viewers. Malik Gul, your final say.
final reflection is things are changing. The NHS has to change. We in the communities also have to change.
Okay.
And there are big opportunities here in Croydon with Dr. Agnelo's leadership, with the NHS leadership, with your leadership and our Muslim leadership. Let's take those opportunities to improve the healthcare of our communities.
Okay, so what you're saying, the future is bright.
Our better days are yet to come.
Okay, so here it is. Today we had two very special guests, Brother Malik Gul, who is the director of WCN, Wandsworth Community Empowerment Network, and pleased to inform you that he will be working very closely with Dr. Agnelo Fernandes here at the Croydon Borough especially, and we are following up from this discussion about health inequalities in the Muslim community. We're going to reach out to all of the mosques here in the Croydon Borough. And yes, indeed, we have already reached out to the Imam of the Pearly Mosque. Is that correct?
I think that's correct, yes.
Yes, that is correct. And we hope as we are in the stage where we're going to rebuild the Pearly Mosque and we want to accommodate and have a very special, hopefully even a surgery for the doctors to come and visit and help and support our community. I end with this reflection. Khairun nas may yanfa'un nas. Beautiful statement. The best of people are those who benefit other people. Until my next reflection, Assalamu alaikum wa rahmatullahi wa barakatuhu. Okay.
That went quick.